Aloha, everyone. My name is Liza Ryan Gill, and I am the campaign manager for the Flavors Hook Kids Hawaii campaign. Thank you so much for joining us today with the American Heart Association. We are going to be talking about the menthol myth and why menthol is so important as we are fighting against the youth vaping epidemic. So today, first we're going to go through a quick introduction and then some housekeeping notes. Then Dr. Robertson will be talking about the science behind menthol and some of the recent studies and clinical research that is happening there. And then we're going to go to Ashley Bell, who is going to be closing with the menthol loophole in policy and what American Heart Association's recommendations are for policy. Lastly, we will be doing question and answer. So just to remind you you can add your questions in the Q&A box, and then we will note them. And at the very end, the last 15 minutes, we'll be going through questions and answers. So without further ado, I'd like to introduce Dr. Marie Robertson. She received her MD from Harvard Medical School in 1970 and trained in internal medicine at the Mass General Hospital, MGH, not far from where I used to live in Boston, and in cardiology at the Johns Hopkins Hospital. She joined the faculty at Vanderbilt University Medical Center, where she was professor of medicine cardiology until 2003, when she joined the AHA staff, so American Heart Association. Since 2012, she has led the American Heart Association Tobacco Research and is now I don't know this one, is it co-PI or co-PI or co-PI?
That's right, co-PI.
Co-PI, okay, of ATRAC and the AHA's NIH and FDA-funded Tobacco Center for Regulatory Science, which supports basic clinical and population research with a focus on the cardiovascular effects of tobacco product use in underserved populations. I had to read all of that because it was quite technical, and I wanted to make sure that I didn't get any of it wrong. We also have Ashley Bell with us, and she is the Vice President of Advocacy Consulting and the Tobacco Strategic Policy Lead for the American Heart Association. In her consulting role, she leads a team of 3 consultants who serve as the content experts for all policy issues within the AHA portfolio. In her tobacco strategic policy lead role, she leads the high-level strategy to advance the tobacco policy priorities of the American Heart Association through national strategic plans and by driving accountability through through federal, state, and local campaigns. Ashley is approaching 15 years of service at the American Heart Association. And we're so delighted to have 2 amazing women with us today to talk about these issues. For those of you who are unfamiliar with the Flavors Hook Kids Hawaii campaign, American Heart Association is a critical component of our steering committee that has been driving this campaign here in Hawaii. And Don, who is also on the line, is our local representative working hard on our federal or at our state level here, but he is backed up by this amazing team at the national level, of which Dr. Marie Robertson and Ashley are a critical component. So just to reiterate on the housekeeping measures, this is being recorded. And we will download this recording. We will add it to our Flavors Hook Kids Hawaii YouTube channel, which will then get posted on our website. And we'll make sure that everybody who registered for this webinar gets that link. It'll take us about 2 to 3 days before it's up. So you won't have it immediately, but you should have it by Monday next week. Again, please use the question and answer box to ask your questions. They won't show up immediately in front of everybody, but we will be noting them and we'll try to compile. So if there's repetition, then we just put 1 forward, and then we'll have either Dr. Robertson or Ashley answer those in the last 15-20 minutes of the webinar. If we don't have an answer for your question, we will do our best to find an answer and to also put in that follow-up email for you. And as many of you know, if you've been on previous ones of these webinars, this is just one in a series, but if there is something that we are really missing that you would love for us to respond to specifically about here in Hawaii, and our tobacco campaigns and ending the youth vaping epidemic, please let us know. we are open to ideas, and we'd be happy to pull together anybody from our network to get some information out there via webinar for you. So without further ado, I will pass it on to Dr. Marie Robertson.
Liza, thank you so much. I'm really pleased to be with you all today. I'm only a little disappointed that I can't be with you in person. It would be even more wonderful to do it that way. But I've been very pleased to hear about how active the campaign is in Hawaii to make sure that we do all we can to raise a generation of the next generation of young people who aren't burdened by the diseases that tobacco can cause. And presumably everybody who's listening is well aware of those. So I'm going to not spend much time on background. I've taken the liberty of broadening the topic just a little bit. I will talk about menthol and show you some of our data on it, but I think to talk about tobacco product flavors in general might be useful, and so I'll do that, but I'm happy to answer further questions when we get to the end. So if you could just move to the next slide, just to put in context the work that the American Heart Association's tobacco programs do. We have many programs. Ashley will tell you about the most important ones. But since 2012, we have been funded by the FDA through the NIH as one of the tobacco centers of regulatory science that the FDA brought together to help them answer the remaining questions about tobacco products, and to make sure that they had the information that they needed. So we brought together a multi-center, multi-organization center with the mission you see there. As with the American Heart Association, that's our overall mission, but here specifically we're working to provide scientific evidence in areas that the FDA needs related to tobacco product use. And I've listed the institutions that are working with us in this regard. You could move to the next slide, where I list a little bit of how we're doing that. Regulatory science is a little different from science in general, because it's science that is directed at the kinds of questions that regulators need, whether that's at a federal, state, a local level, but to provide evidence so that they can make decisions, both in terms of regulations and in terms of their communication efforts with the public at all levels. And so within ATRAC, our shorthand for our particular center, we actually include basic clinical and population science studies, as Liza mentioned. So in our basic studies, we work with mice, we do exposure studies so that we can assess the role of different kinds of compounds, not just, for example, exposing mice to cigarette smoke, but to e-cigarette vapor, to the various components of e-cigarette vapor, including flavors. We do studies and in those basic studies, we also do some work with induced pluripotent stem cells, and those are cells that we can get from taking a little skin biopsy or a scraping from the inside of a blood vessel, a vein, when blood is drawn, and make those cells into whatever kind of cell we need. So we can make them into heart muscle cells or the lining of blood vessels, and we can then study the effects that tobacco products of all kinds have on the cells of our bodies. And those, in our particular case, we think about the cardiovascular and cardiopulmonary effects, because those are the things that fall within our range of expertise. There are other T-Core centers that work on cancer and other lung problems. We're also interested, and particularly in disadvantaged populations, on some of the issues that help us figure out how to communicate better. So we want to know what the public knows and what their attitudes and beliefs and behaviors are, both for adults and children. So we do some work in schools and in pediatric clinics. And in particular, we always try to enrich our populations that we study to make sure that we're representing the people that are most affected by the burden of tobacco disease, either by race, ethnicity, by socioeconomic status, by where they live, by communities like the LGBTQ community, where there's a high incidence of tobacco product use. And we do all that with the FDA and the other 8 tobacco centers of regulatory science. Next slide, please. So flavors, why should we care about flavors? And in particular, we think about a lot of the components of e-cigarettes, but today's topic is flavors. And there are a number of reasons. Of course, as you know, flavors really exploded when we began to have e-cigarettes on the market. There were some flavors in, both in cigars and in cigarettes. Menthol was certainly there at that point. But suddenly we were seeing, at first tens and then hundreds and then thousands of flavors. And, as we looked at that as a tobacco center, we saw that those flavors were being used coming from a list that the FDA calls GRAS, generally regarded as safe. So there's a long list of compounds that the FDA says you can put in a food product, people can eat this, and in reasonable quantities, you're not going to be harmed by that. But we knew, although it wasn't perhaps so clear certainly to users, maybe even to industry, although hard to think they wouldn't know this, that flavors that are generally regarded as safe if you eat them, put them in food products, aren't necessarily safe to inhale. Think about water. We can drink all we want, but it's not a good thing to have in our lungs. And the same thing is true for a number of the chemicals that were being put into e-cigarettes. So we were concerned from that point of view, and I'll tell you a little bit about those studies. But of course, a big issue was that those flavored tobacco products really outstripped the rest of the tobacco product market. So suddenly, those were really the products people were using. And when you looked at the flavors and the packaging, it really did seem aimed at our children. No question that flavors like unicorn and cotton candy weren't being used to attract adults to tobacco products before, and packaging that looked like kids' food products, again, were certainly not aimed at selling something to adults. So it was clear that industry was aiming at youth, and that was a huge issue for us. We had all worked very hard to reduce and prevent tobacco use in the past in youth, with many organizations, the Campaign for Tobacco-Free Kids among them, but many organizations worked on that. And we had been really quite successful. However, what we saw was that the less than 5% or so of youth that were smoking, suddenly we had 15, 20%, now almost 30% in Hawaii, I think, of youth who were using tobacco products far outweighed the decades of effort that we had put in to get to the success that we'd had. And suddenly a quarter or a third of youth were using products that would ultimately addict them to nicotine. The other major reason, and I'll come back to this in a moment, but there has been some controversy about flavors in adults, the controversy about e-cigarette use in adults, whether because there are fewer constituents in e-cigarettes, whether they are safer for adults to use than cigarettes, and should we be encouraging adults to switch? I think the jury is out on that one. We don't know. We're developing more information, more evidence all the time, and we find that some of the constituents of e-cigarettes are harmful and will likely be harmful and cause harm in adults. So our approach has been to say that if adults switch, they should also make plans to quit using e-cigarettes as well. Next slide, please. But flavors were a big part of that discussion. So are flavors safe? One of the really dramatic stories that made it clear to us, any of us who've been around long enough to know about this, that flavors might not be safe, was the story of diacetyl. Diacetyl was one of the flavors used in e-cigarettes as this explosion of flavors began, and produces a kind of a popcorn buttery feel. So if you if you buy microwave popcorn, it used to be that the buttery flavor you would find with it was caused by the use of diacetyl. But it turned out that people who worked in factories that used diacetyl and put it into products developed lung problems that were ultimately fatal in many of those individuals. And diacetyl was then removed as that flavorant because it caused a disease called bronchiolitis obliterans. And something that obliterates part of the lung is obviously, that's a serious problem. And because it was discovered in popcorn factories, this was kind of colloquially called popcorn lung. So we knew from situations like that flavors could be harmful when inhaled. Now, those flavors can also be harmful inside blood vessels or circulating through the blood and affecting cells in the body. And this is just one quick example. Nitric oxide, NO, is a chemical that's made by the lining cells of our blood vessels. It helps them dilate, providing enough blood flow to whatever organ they're supplying. And when we studied a series of flavors, we found that methanol, this slide demonstrates methanol. So you can provoke endothelial cells. I don't know if you can see my pointer, probably not. So the gray bar is the increase in production of nitric oxide when cells are stimulated. Endothelial cells we could take from people, grow them up in culture. But when menthol was added to those cells, or they were exposed to menthol at quite reasonable levels you would see in people, that production went way down. We saw inflammation in those cells studied when they were exposed to things like menthol. Eugenol, one of the other flavors, is the kind of clove-like flavor that you see in some products. And we subsequently used cells called iPS cells. I'll show you a little bit more about those in the next slide. But iPS cells, again, allow us to have heart muscle cells. Hard to get heart muscle cells from human beings, but you can take a skin cell and treat it appropriately, and you can grow it into a heart muscle cell, and we can then test them. So let's go to the next slide, and that just lists on that next slide there we go. Joe Wu at Stanford is doing this with our group now, but has been using these iPS cells to assess toxicity of flavors and other components of e-cigarettes. So in some of his studies, he also used cinnamaldehyde. That's a compound, a chemical compound that produces the flavor of cinnamon. Very nice flavor, one of my favorite flavors. Great in cinnamon rolls, not so good if you inhale it or if you apply it to endothelial cells. And you know, here you see a long list of the things that that e-liquid flavored with cinnamon could do. Cells, in fact, didn't last as well. There were increased reactive oxygen species causing oxidative stress, a series of chemical reactions that showed that these endothelial cells didn't function in the way that they were supposed to. In fact, Joe went on to do some studies where he'd look at, because one question is, are those compounds actually circulating in individuals? And if you expose these endothelial cells to the serum that you get from an e-cigarette user, you see the same sort of endothelial dysfunction. So we're seeing ways in which e-cigarette components can affect the cells of our bodies. Next slide. So, little piece missing there, but so this was, these are some of the results. As we saw these deleterious effects, we were particularly interested in how teens, whether these vaping, these flavors added to vaping products were, it seemed that they were aimed at marketing to kids. You know, were they actually having the effect that industry wanted? So we wanted to discuss that and ask questions about that with kids. So we surveyed using a national survey vendor that the HA uses when we want to get kids' opinions about things, and asked them many questions about tobacco products that they were using, and found, not surprisingly, you would all recognize this, that electronic nicotine delivery systems were the tobacco products now that kids are trying first. So it's not that they try regular combustible cigarettes and then switch to e-cigarettes. E-cigarettes were so popular and attractive and had these clever flavors named cleverly and put in clever packaging that kids were starting those and being exposed to nicotine with those products without ever having tried a combustible cigarette. The flavors were highly attractive to them, and kids told us that flavors were a reason that they would start smoking, that they would initiate using a nicotine-containing product, and that they were a reason that they continued. Sometimes youth, even at college age, would not recognize or think about the fact that there was nicotine being provided. Many did know that, but there were a substantial portion who really thought about the flavors more than they thought about the cerebral effects, the brain effects that they felt from the nicotine. Most of them used flavored e-cigarettes. And in our study, you know, almost 70% used something that was sort of fruity flavored, but more than half used something that had a mint or menthol, often menthol component, and others used sweet candy-like things. Obviously, those add up to more than 100 because a number of them used multiple different kinds. Let's see the next slide. And this is that survey was done a couple of years ago. This is a more recent survey published just last year, just demonstrating the kinds of flavors that kids used. And you can again see that pile of fruit there in this survey, using fruit flavors was especially common, but the next most popular was mint or menthol, and the two tobacco flavored ones above were very rarely used. There were sweets, again, that cake and various other kinds of flavors. And you can see in the pie chart, we don't need to really spend much time on that, but you can see that kids use these in many different ways. At the time this was done, Juul was still a highly favored product, easy to conceal from parents and teachers, and but other e-cigarettes, modular e-cigarettes where you can modify what you put in them, hookahs, all of those were certainly used, and I'm sure you've all seen the ways in which kids use them. I thought that the most remarkable I saw was the hoodie that had in its strings a tube that you actually could vape through that was connected to your e-cigarette. With Hawaii's weather, you probably don't need or see as many of those in the schools. But next slide, please. So these continue to be a major issue and attract kids. Now, what about menthol? Why do we care particularly about menthol, and why is it such a popular part of smoking anything, smoking combustible cigarettes, smoking e-cigarettes, vaping e-cigarettes as well? And it's an interesting question, and there are some parts of it that we still need more research on. No question that menthol does produce, when you inhale it, a sort of cooling sensation. And tobacco smoke without that is often described with words like harsh or bitter, or as some other unpleasant feeling word. And the cooling sensation of menthol, the feel that it has for people, either mouth feel or lung feel, reduces that and makes it easier to smoke. Even when kids were smoking only combustible cigarettes, it made it easier for them to smoke than if the menthol weren't there. Now, as we've tried to figure out why that is, there is a strong sense and some data to suggest that because tobacco smoke is quite alkaline, that is a substantial cause of that harsh feeling in the mouth, and that because of that, obviously some people can smoke and inhale tobacco smoke without menthol, but it certainly seems to help. And in many populations, more than 80%, for example, of African Americans use menthol-containing cigarettes if they're smokers, and e-cigarettes initially had the same, at least to some degree, had a similar harshness and a similar alkalinity. Now, with Juul, there was a switch to the use of nicotine salts rather than the nicotine that had been being used before. And one doesn't have to have an alkaline environment to have nicotine absorbed from nicotine salts. So whether one could design an e-cigarette in which menthol, because you would think that menthol wouldn't be needed in products like Juul. And of course, now there are many either Juul knockoffs or other products that are using nicotine salts. But menthol has remained quite popular, whether that's because it's associated with a more pleasant feel, whether people feel that it makes their breath better if they're using either cigarettes or e-cigarettes. And still, more than half of youth smokers use menthol cigarettes. So, and in addition to the African American population, non-minority youth, unemployed populations, those in a low socioeconomic status, also find menthol products more popular. We think that more studies are needed about how one could understand better the role of menthol, but no question, it makes it easier, more pleasant for people to use tobacco products, whether e-cigarettes or cigarettes. And so if we really want to reduce youth use and adult use, we need to get menthol out of the way as well. I know Ashley will talk more about that. Next, let me say that among many other issues brought us to recognizing that we needed to support further research for children and teens. And part of that was because the Family Smoking and Leave Act specifically didn't allow the FDA to spend their funds on assessing cessation from tobacco and nicotine use. So we thought that was a critical thing to do. And so ENACT, End Nicotine Addiction in Children and Teens, was our answer to that. And that is a research initiative that includes supporting several centers, as much as $20 million worth of research, but particularly with an issue on cessation. So while there are absolutely programs that can help kids, I think you had earlier Bonnie Halpern speak about the program that they've developed. New products, new programs are being developed, but large-scale, well-designed clinical trials with good long follow-up surveys, have been hard to come by, and the FDA's program won't be able to take us there. We think that study designs that are both effective and demonstrate reach, that they, not every population will need or want the same sorts of answers. And we need to understand how different kinds of products, menthol included, may need different approaches if we're going to foster cessation. Next slide. So as we started that study, we did some focus group research to help us help inform what we were going to ask investigators to do. We found, from talking to kids, from talking to school superintendents, from talking to parents, but particularly from youth, we found that youth in many cases want to quit and don't know how. They don't, they're, as they get older in particular, are educated better, understand issues about health concerns, and they don't like, once they think about it, being addicted to something, being controlled by a substance. But addiction makes it very tough to quit. Kids are also exposed to stress at levels that that they haven't been in the past. They see many of their peers using e-cigarettes. Kids tell us that, when you ask them what they think about the data about how many kids use, they look at you like only a teen can look at you when they know the answer and you don't, and they say, oh, your numbers are way low. And we heard that over and over from kids. And, when they're not stressed, they're bored, and this is another sensation that they like. And most of the kids we talked with had not tried other interventions. They hadn't tried nicotine replacement therapy. Some trials of drugs have not looked as effective. They hadn't tried some of the texting programs. So we think new programs continue to need to be advanced, developed, improved. And we think that there's no reason to think we shouldn't be able to help kids more. Next slide. So we've supported these investigators, Naomi Hamburg at Boston University, Peter Moeller at Ohio State, and Suchitra Krishnan Saran at Yale, all of whom will be providing information on how nicotine affects the developing person, the developing brain, but also other organs in the body, and helping to work together to develop even more effective programs than we have now. Next slide. And this slide I put in not really to discuss, but just because everyone's thinking about the coronavirus and the disease caused by it, and issues have come up about smoking and vaping, and could they be protective? Could they greatly enhance risk? We think more likely that they could enhance risk if they cause, as we think they do, damage in the lungs. We know that this disease is not just a lung disease. We see an increasing risk for youth, a great increase in people, not so much in their, in middle school and high school, but even in high school and certainly college age and young adults, we see more and more of those being affected by COVID-19. And the AHA has in fact mounted, just as we do quality improvement in hospitals for heart failure and ischemic heart disease and stroke and atrial fibrillation, we have now started a COVID-19 registry to help with both quality improvement and information gathering about how coronavirus operates in hospitals, how patients are affected, and as part of that, how many of them in fact were smokers or vapors before they came in, and what sort of effects the coronavirus has in people who've already sustained some lung damage. So I'm going to stop there for questions. I think my next slide says questions, and let Ashley take you to the next part of this, and then we'll be happy to answer questions.
Yeah, Dr. Robertson, we're actually taking questions in the Q&A box. So if they have questions there, and then we'll do them all at the end. So I'll go straight on.
Okay, very good.
I'll go on to Ashley now.
Okay, great. Aloha, thank you so much for allowing me to present today. You can go to the next slide if you want to. So just, you have heard the science. So you've heard from Dr. Robertson, you've heard about tobacco and tobacco flavor specifically. I'm going to talk a little bit about the Heart Association's tobacco policy recommendations. And so in general, we support legislative, regulatory, and executive efforts at all levels of government, federal, state, and local. We want to make sure that our tobacco policies are including all types of flavored tobacco products. So all flavors and all types of products that are flavored. Important not to forget the cigars, flavored cigars, cigarillos, hookah pins and hookah, as well as smokeless tobacco and e-cigarettes. And so when we talk about characterizing flavors, we mean everything except tobacco flavored products. So if it even mint or menthol, we are really clear about that. And then the other really important thing is that any tobacco policy should be free of any provisions that would prohibit the local government or a lower level of government from taking additional action. So in our federal work, we try to make sure that nothing in the federal policy would preempt the state level from passing something more restrictive. Similarly, at the state level, we would only support policies that do not prevent the local governments from taking further action. And so if you can go to the next slide, more specifically, the tobacco policies that we've worked on at the American Heart Association that we're working on right now, restricting the sale of all tobacco products to adults, people 21 or older. Obviously, Hawaii was one of the first states to have accomplished that at the state level, and now that policy is in effect across the United States because it was signed into law by the president at the very end of 2019. So federally, the age of sale for all tobacco products is 21. We would advocate for including e-cigarettes in any comprehensive smoke-free laws. We would advocate for cigarette, e-cigarette, and other tobacco product taxation at the same levels. And so when we talk about tobacco tax campaigns, we talk about trying to raise the product taxes to the same rates and then raise them incrementally thereafter at the same time, so that all products are being taxed fairly across the board and being raised at the same time. And obviously the policy that you all have been working on in Hawaii is the eliminating the sale of all flavored tobacco products in any given jurisdiction. Of course, we've seen lots of success across the country in that policy. Massachusetts and California have really led the way in that policy, and Massachusetts had about 150 local policies before they became the first state to pass the comprehensive state law. California has, I think there are probably more than 60 or so comprehensive policies at the local level now, and in fact have a state level bill moving through the assembly there right now. And then important to remember, we do support robust FDA regulation over all tobacco products. Next slide, please. And so that's one thing to mention as we get into this. So if we take it back just a little bit, we just this week actually passed the 11-year anniversary of the Family Smoking Prevention Tobacco Control Act. And so that bill was signed June 22nd, 2009. And it's important to remember that was the bill that gave the FDA authority over all new tobacco products. It gave the FDA authority over marketing of tobacco products, and it also gave the FDA authority over all forms of marketing and all different types of tobacco products. But we didn't know it at the time. But what it importantly did was it gave the FDA authority over the modified risk tobacco products and electronic cigarettes. They weren't really on the market that much yet, but that pretty clearly was established in that. The other thing that it did was that it did pull other types of flavored cigarettes off the market, except menthol and tobacco flavor. So until that time, I don't know if you all remember, there were clove cigarettes, there were cinnamon cigarettes, there were all different other flavors of cigarettes. Now, unfortunately, what it did leave on the market, and something that's important to think about as we're working on these flavor policies, is it did leave on the market the flavored cigarillos, the Swisher Sweets that are 3 in a pack for 99 cents that come in all flavors like mango and watermelon and all these really youth attractive flavors. It also left on the market, and this one really drives me nuts, these packets of cigars that are 22 a pack, look exactly like a pack of cigarettes, cost in most cases less than a pack of cigarettes. All kinds of flavors of those are left on the market. Strawberry, peach, apple, grape, everything possible. So so there were 2 big sort of carve outs there. And then of course it also left other flavored tobacco products of all their types. So fast forward from June 2009 to January 2020. And it really started in the fall of 2009 when the president from the Oval Office, with the First Lady at his side and the Secretary of Health, the Secretary of HHS at the time, sort of announced, we're going to take these flavored products off the market. And it was really in response to the EVALI, the sort of the epidemic of e-cigarette use, but also the lung injury and the things that were going on at the time where largely young people were dying and where it was, tied to e-cigarette use. And so at that time, there was a big announcement. It took quite some time for the policy to be written, and the FDA policy that came out was in fact pretty disappointing to most folks who work in tobacco policy. So it basically didn't cover all flavors, but it also didn't cover all products. And so it doesn't apply to mint, menthol, tobacco flavored products, but it also doesn't apply to the things that are self-contained. So the hookah pins and the things like Puff Bar and things like that, it really just applied to the cartridge pod based e-cigarettes. And so that was really disappointing policy because it left menthol and tobacco flavored of all types of electronic products, but then it also sort of carved out certain types of products. That is in effect, and it has been being enforced since February. If you'll go to the next slide. It's important to see what is still on the market. So this next slide shows you all the things that were not impacted by that. And so obviously what I would pull out for you here, and I think the one that has become the biggest market share and has really swooped in and taken over from Juul is the Puff Bar. And so if you, obviously you can see these lot of flavors, very attractive to kids, rainbow colors. And if you go to the next slide, you can see something I actually found in Googling. This little picture over here is from a website one of the vape manufacturers in Hawaii runs, and you can click through there and just find where to purchase the Puff Bars in Hawaii. So I thought that was really interesting that you know, all you had to do was Google, where do I find a Puff Bar? And that, I mean, that's an entire class of products that is not impacted by the FDA's action earlier this year. And so Rosemarie's already talked about quite a lot of the science, but it's just important to remember that not only are these menthol products more attractive and because they do sort of mask the harshness, but they also have for generations been marketed to young people and really heavily marketed to minority populations. I mean, they you know, if you go back and look at all the pictures, they have, you know, you look at the pictures in the 70s, 80s, 90s when they could still do marketing. Clearly they were marketing to a target audience. And so that has been carried out, of course, in the use rates that we're seeing. It's also, and even for adult cigar users, I thought that was, you know, that's the preferred flavor. So if you go to the next slide, I think, so this next slide, when you talk about marketing, okay, so this is Volcano, which I'm given to understand is one of the more popular vape shops in Hawaii. If you Google them, you will find their videos that they have, somebody has loaded onto their websites or on YouTube or whatever, and they have all these marketing techniques where they have coupon codes. And this to me looks like a very young person using an e-cigarette. Now, granted, I'm in my mid-40s, so everybody's starting to look young to me these days, but you know, this is an example of marketing to young people, and this is what is happening right there in your own state. And then if you go to the next slide, I think the last thing that I wanted to cover and what sort of why I was invited today was to talk about what is absolutely necessary to see in a flavored tobacco policy change. And so I've mentioned a little bit about this, but policy proposals have to include all tobacco products, including e-cigarettes, and all flavors, including menthol. And so for the Heart Association to be able to support a flavored tobacco policy and the ones that we've supported in Massachusetts and all over the state of California, and we have had, I think, probably 60 or so active flavored tobacco policy campaigns across the country this year. So regardless of the ones that have been moving organically in a lot of the places in California, we have been at the helm and leading 55 or 60 campaigns ourselves with the Heart Association. The other 2 or 3 things that are really important to highlight are that there are some inherent equity problems in the enforcement of tobacco policies. The first of which is that a lot of the old tobacco control laws have in them components that would penalize, in most cases, a person who might be a minimum wage retail clerk for an infraction. So if they sell to somebody who's underage and they didn't check the ID correctly, or they didn't ask for an ID, that penalty goes directly to that clerk in most places, and they can be hundreds of dollars up to thousands of dollars. Obviously, we think that nobody should have to pay something like that to be able to work in their job. They should be trained well by their company, and the company who owns the company, who has the tobacco retail license, who is responsible for reporting to the state or the jurisdiction, should be responsible for training their employees, but also for making sure that their employees know how to execute correctly the provisions that need to be in place, and that they should also be responsible for the fees or penalties. Secondarily, and maybe even more importantly, is that a lot of our tobacco control laws continue to carry forward what we call PUP penalties, so possession, use, or purchase penalties. And those are things that could be used against a young person. For example, there's a group of young people walking down the street, and in some states there are laws on the books that would allow a police officer to ask those young people to come over and check to see if they have any tobacco products in their possession, and they could actually be given a ticket or a fine because they are in possession or using a tobacco product. And we think there are significant ways that could be applied unfairly from an equity perspective. And so in all the flavor policies we also talk about making sure that those old purchase, use, or possession penalties would be removed as the policy moves forward. And then we also want to make sure that there's an evaluation requirement so that you know what impact the policy is having. And the thing that is not on here, but that's really important also, is some sort of retail licensure, because the best way to actively implement and enforce a flavored tobacco policy is going to be through some sort of licensure of those. If you know in your state all the places that are selling tobacco products, then it's very easy to roll out, okay, and now the change is no flavored products. You can keep selling your other products, but you have to pull the flavored products off the market. So I'm just realizing I need to add that retail licensure is an important component. So those are the sort of critical core components of tobacco policy around flavored products. And that was, the main thing we wanted to make sure and share. And I think that's actually the last slide. So hopefully we've left ourselves some time for Q&A.
Thank you so much, Ashley. I appreciate it. So we have a few minutes left here, and we did receive some questions through the Q&A box. And so I will, I'll put those up, and then I know, John, we didn't introduce you, but as a member of the American Heart Association here in Hawaii, if you feel that you need to respond or that you have the right answer for this, please feel free. But I will remind you, we have 7 minutes left, and so we will have to be brief. The first question that I received was, obviously here in Hawaii, our demographics are slightly different than on the mainland. We have large Native Hawaiian populations, large Filipino population. I mean, our Native Hawaiian population is approximately about 20%, and then another 18 or so % is Filipino. What does menthol use rates look like in those communities? And is there any research being done in Hawaii? So I don't expect you, Ashley, or Dr. Robertson, to know that, but maybe Don, do you have a short response to that? I put him on the spot.
Don, you're muted.
Sorry. Yeah, sorry. I'm not familiar with any research currently in Hawaii. I know that UH is doing research through their Cancer Research Center, but I'm not familiar with anything specific to this issue.
I'd say it's very tough to get information because the way in which many of our national surveys work, they aren't able to, they do a representative look at the population, but that doesn't cover all groups effectively. So there are Native American populations that are not covered well. The Asia Pacific Island population is not covered very well. Native Hawaiians, I think, are understudied. So, part of being an underserved population is being an understudied population. So more information is needed, before we can know that. But let me say that, all populations can be addicted to nicotine. Yeah. So there's no question that we want to prevent youth use in all populations, and make sure that people in different populations know the potential long-term risks. Joe Wu, whom I mentioned before, has just presented. There's a well-known in I think Eastern Asian populations. I think that's right. A genetic issue that makes some people flush tremendously when they drink alcohol. So they often know that they have that genetic marker, and they often can't drink alcohol very comfortably. Well, those people are more prone to damage from the components of e-cigarettes as well. So, having with that's data that is, still in press, but coming along, and so you'll see it in the paper in a few months perhaps. But within many populations there are people who will be damaged more, but for all of us, all people and all populations, the effects that both cigarettes and e-cigarettes have are pretty uniform. Some will be worse, but no one will be immune.
Thank you, Dr. Robertson. And I will just say that we have sorry, 1 second here, Don. I just want to make sure we have time for the other questions. But that we will respond. I know that the Hawaii Public Health Institute has some more research that we've done on that. And I'll try to include some of those findings in the email that goes out, because we do know kind of anecdotally that rates of menthol use are especially high in Native Hawaiian populations and Filipino populations. And we know from a marketing perspective that Big Tobacco marketed to Hawaii the same way that it marketed to urban African-American communities, and that amongst the large tobacco companies, Hawaii is known as the menthol state. And so those are some tidbits we'll put in a follow-up email for those that are interested. And on that point, one of the questions that I have is why, we're celebrating 10 years of most flavored tobacco products being off of the market. Under that 2009 regulation, why was menthol left in if it is a flavor?
Of course, because there was enormous pressure from the tobacco industry, just as there was when Canada tried to do the same thing. Canada was actually, perhaps more effective than we have been at a province level in restricting menthol-containing products. But every time, in every province, as they tried to do that, there was tremendous pushback from industry, and their systems are a little different, so they were able to be more effective, a little more easily.
Thank you for that, Dr. Robertson. So, and there's one point that I know that we have 1 minute left here, and so I'll be closing up here and thanking you folks for giving your time. But one note that I wanted to make is that in the attempt for the FDA regulation just recently that went into effect in February, one of the impacts of having such a large loophole for menthol that impacts us here in Hawaii is those products like disposable e-cigarettes and other e-liquids that are on the market. Maybe previously they were mango or lychee, and now they become things like frozen mango or lychee ice. And the reason why you see those kind of modifiers on it is because it's menthol. And so you can take a flavored product, add menthol to it, and then it can go through the loophole. And so that is something to watch out for, those proliferation of those types of flavors.
And the same thing happened again in Canada. You know, when these situations came into play, the industry often responded by changing the name or continuing the look of something to make it either seem that it had menthol or to in fact allow it. So it's very important that the FDA actually controls the components, all the constituents. In the chat room, there was a comment a while ago that you know, there's pushback against the concept that kids could be addicted, but kids are addicted. Kids can tell you that they and their classmates can be addicted and that they try to quit and aren't able to. So support for kids in schools who want to quit, and maybe support that isn't in the school because they're embarrassed if they're in the school. Finding those avenues for kids is really important as well.
Absolutely. And we are right on time here. So if there are further questions, please feel free to email me. I'm Liza at flavorsforkidshi.org. And thank you so much to Dr. Robertson and Ashley for joining us from East Coast and in a totally different time zone for us to do this at noon. We so appreciate this collaboration and being in the same buoy with the American Heart Association. And we know that we will keep fighting this fight until we have more victories. So thank you so much.
Great. Thank you for having us.